muscles, these wonderful muscles. I love TMJ clients. I don't love that my temporal mandibular joint syndrome clients are in pain, but I love them because they come for hour-long sessions, usually just on their head, neck, and shoulders, and I can sit there and I can work all that stuff out for them, and they get so much relief from it. And there's not a lot of things to fix TMJ. And I keep saying TMJ, which everybody does, but everybody has a TMJ. That's your temporal mandibular joint. I really mean TMJ syndrome in this case. They used to do surgery for TMJ, and I don't think it's done at all anymore because it just didn't work to where it's some of the medical stuff out there says just don't do it. Yes, Ms. Monreal, please.
So, I have a question as far as tinnitus.
Yeah.
Or even vertigo.
Yeah.
Because, I mean, they say that's an inner ear. I mean,
Yeah.
it could be like, a cervical problem.
Yeah.
But, so if we're talking about the fascia and the fascia was restricted in the neck, why wouldn't it reach the muscles which are so tiny in the ear, correct?
Correct. I don't know if there's a direct fascial connection to the muscles in the ear just because I haven't studied the tiny little muscles inside the ear. But yeah, that's not far-fetched. The other thing that's not far-fetched at all when it comes to tinnitus, which is really kind of ringing in your ear, and to vertigo, which could be messing with the inner ear, is that ear hole, right? That ear hole is in your temporal bone. So that's your ear hole. Look, by the way, here's your ear hole. Here's your jaw.
Flush again.
That's your ear hole, and here's your jaw right there. And this is your mastoid process, which has the sternocleidomastoid hook into it, the longissimus hooking to it, the semispinalis capitis hooking to it. There's a lot going on in this temporal bone. And if you're somebody who grinds your teeth and stuff like that, your masseter actually hooks to your temporal bone again here. There's all these important features to the temporal bone. And if that bone shifts just a tiny, tiny bit, that would be plenty to give you ringing in your ear. It's one of the reasons I made such a big deal out of the temporal bone this whole time, is it's so key and there's so many things hooked to it, and, it shifts a little bit and you get problems.
So I just want to run my thought process by you just to see if you think it makes sense.
Yeah.
Okay. This is just what I picture in my head.
Yeah.
So again, if fascia is woven through every single thing in our body somewhat.
Yeah.
So again, if it is restricted in the neck, wouldn't that inhibit the communication that it would have with those tiny, deep muscles?
Yeah.
I'm just, I try to picture things in my head, because I know people have said, you can't really affect the inner ear by working these muscles. I disagree.
Oh, I do too. I do too.
Yeah.
I had a woman who came to me years ago for ringing her ear. And we found that neck massage and head massage was very effective for relieving it for her. Now, I'm assuming because of the fascial connections too. I'm right there with you. But for whatever reason, yes, there's lots of connection between stress and ringing in the ear. Muscular stress, right? Mm-hmm. So absolutely. Yes. I think there's loads of evidence for that.
And then, are you familiar with this thing that people do that looks and sounds so weird, but they stick their fingers in your ear and then somewhat try to massage the inside of your ear? They're it's the weirdest thing, but I don't really know what.
Have you ever had somebody do it to you?
I have had, and it's weird. But
I can come show you guys why we do it. It's very effective. The reason is, if I stick my finger just a tiny bit inside your ear, and by the way, I do ask clients for permission for this. I don't just, boom, even if they got TMJ. I'm like, can we gently put our finger a little bit in your ear? But the thing is, yes, I'm in the ear, but I'm also at the back of the jaw joint. And so if you guys stick your fingers in your ear and push forward and open and close your jaw, you'll actually feel your jaw joint in there. And then you can start to get into it and open it up. And so we'll work the jaw joint from the inside, and we'll sometimes even have the client slowly open and close their mouth.
Oh, well, that's cool. The class that I took, they didn't even explain why.
Oh, they
They
should.
just told
Yeah.
you to do it.
No,
So
and
I
then
was
what's
just
kind of
kinda
cool
like-
too is it sounds weird, but if you kind of pull in one direction, then twist your ears, you kind of actually unscrew all the fascia in there. You'll actually stretch it.
That's really cool.
Yeah,
Thank you for explaining
If you
that.
want me to show you in lab, Miss Monreal, like come by and wash my hands and stick them in your ears and stuff, I will, because I think
Okay.
I think I can show you the nuance, and you'll be like, oh yeah.
Yeah, that's really cool. Okay, I'll make sure to clean my ears out too.
No, I like it. A little extra lubrication. I don't need any lotion though. Just use a little bit of your wax.
Okay.
Come on, we'll
All right.
Shrek it too. We'll make a little candle afterwards. Yeah.
Nice. Okay.
Cool. All right. Okay. Anyway, yes, Miss Monreal. Thank God you and I both believe that, because I kind of feel like that's the entire premise of massage, right? It wasn't ringing before, and it is now, and it's probably because of tension and all the fascia and everything. Okay. So, let's see here. Here's a lovely picture of the masseter, right? It actually attaches to the zygomatic arch. It is a two-bellied muscle that attaches to the zygomatic arch. What's the simple term, like if you had to explain to a 5-year-old what the zygomatic arch is, what is the zygomatic arch?
Your cheekbones?
Thank you, it's your cheekbones. And it's actually formed by the zygomatic process of your temporal bone, by something in your temporal bone reaching your zygomatic bone up here. And they make the zygomatic arch. Boom, right here. Anyway, this masseter attaches there. Remember, if you're going to massage this, don't just start in the middle. Literally start on the cheekbone, pressing on the cheekbone, and when you fall off, start pressing 10 times harder. You start from the top, and you take it all the way down as slowly as possible. I love all the people that are touching their face right now. And boom, rubbing that. Boom. Very powerful. I will do this on people who are just experiencing tension too. A lot of us carry a lot of tension here. And I am a big believer, this is just me personal, but I think people develop jaw problems too when they're under stress and want to speak up for themselves but can't. That's not the reason for all jaw problems, I don't mean that. But if you think about that kind of feeling like, I'd like to tell Tapsat what I'm thinking, but I have to keep my mouth shut because I got to pass this class. It kind of builds up tension in your jaw kind of thing. And so it's a great stress relieving. A lot of massage therapists will actually massage the masseter every massage they do. That's not a crazy idea. But for TMJ, we're going to spend a lot of time here, a lot of time right underneath the cheekbone trying to get in the pterygoid. Inside the ear, I'll go inside the ear, I'll hit the temporal bone. And then neck and shoulders all day long. Neck and shoulders all day long. I don't really have anything else to tell you about the masseter. It's powerful, it's fun, it's easily accessible. It's right on the surface. Yes, Miss Petrie.
Is this something, when working on the zygomatic arch and the mastoid, are you using any kind of lotion, anything to help with gliding?
Yeah,
or is
yeah.
it literally just dry work and you're just...
If they're there for TMJ work, I do it dry.
Okay.
You're right, because I am really trying to make fascial stuff, and we're going to be moving very little, very, very slow. If you do use lotion, I mean, maybe just a drop.
Enough for like the fingertips?
Yeah, but you actually would like to catch this. You'd really like to have a lot of drag for this type of stuff, because we're trying to get this tissue to move. So I recommend, for TMJ problems, I recommend dry work, yes. Maybe not the neck and shoulders, though. There you could put some lotion on stuff. But this stuff up here, it works really well dry. You don't want to slide. You want the fascia to slide and your fingers to stay still on that piece of skin that you're on or whatever. Good question. Okay, let's look at the temporalis here, too. The temporalis is much bigger than most people think, right? It's very, very flat. So you'll just feel some kind of muscle tissue here, but it's not obvious. You know, it's very flat. It's not like the masseter. But it does go down into your jaw as well, right? It goes down into the coronoid process of your jaw, which is this bump right here. And it really does go underneath your zygomatic arch, right? Which is why you can't find your guy's hole in your zygomatic arch, because it's filled in with a temporal temporalis muscle. Super important to get this too. I think the temporalis muscle is super important for stress too. We can see how it actually covers over multiple bones, right? Covers over multiple bones. The frontal bone, the parietal bone, and the temporal bone are all in there. Yeah. And sphenoid really as well. Okay. It is unlikely that you guys will work on the medial pterygoid in your massage career, but it does happen, especially if you become a TMJ specialist or something. It acts like a second masseter really inside your jaw, but it is inside your jaw. Yes, Miss Monreal.
How would one become a TMJ specialist?
You'd study all the TMJ muscles really, really good and then practice doing TMJ massage and then put TMJ specialist on your card.
Okay, so it's not a specific training that would have to...
There are workshops that would be very helpful, but no, it's not like you are legally, allowed to massage all this stuff already. Yeah.
Okay.
But this...
Because that's one of the things that I would like to target and then, present myself to dental offices.
Oh, yeah. Oh, yeah. Okay, well, the only time I've ever rubbed a medial pterygoid was the few times that I have worked with TMJ people where we were really getting in there and you actually glove up and you go inside their mouth. And you actually head back towards the back of their jaw. That's where the muscle's accessible.
Which I have done to myself.
Mm-hmm. That's
very painful.
Yes,
but
and that's
good.
funny that you say that because that's how they have you do the workshop too. They make sure you do all this stuff on yourself first before you do it with a partner. It is very painful. Yeah. Were you gonna say something else, ma'am?
Sorry, I wasn't going to, but so that was mainly my question though was, is that something that could be self-proclaimed or is it like a certification that you would have to have?
No, it can be self-proclaimed. It really can. I just be careful anything that you guys self-proclaim that you've trained yourself in it. Does that make sense? But yeah.
Yes.
But yeah. That's unfortunately or fortunately, I don't know which way it goes. Depends how responsible you are. But that's true of most massage things, right? You can claim to be a low back, specialist, a foot specialist, or whatever in massage therapy. Has to be in massage therapy. Yeah. Yeah, well, we've got loads of gloves here. If you guys want to glove up, you can dig around. Okay. So that's really it. We are not going to go after the medial pterygoid in this class. You are welcome to try on each other if that's something you're interested in. Lateral pterygoid we get inadvertently by going underneath the zygomatic arch here, and that seems to work well enough. Especially once you start getting the masseter really loosened up here, you can get kind of into the lateral pterygoid. And from a TMJ point of view, that's the one we really look at because that's the one that when it's tight can kind of pull your jaw out of joint there, because it actually helps you to protract your jaw, and so it can be part of the problem with the tension there. Yeah. And your temporalis helps you retract your jaw too, so these two muscles can actually fight each other. So you definitely would be hitting these three for sure. And then we don't know why to this day for sure, but neck and shoulder tension definitely makes TMJ better or worse. And so releasing the tension, just general tension in shoulders and neck seems to really help temporal mandibular joint syndrome. Okay, so that's it for those muscles. Let's take a break because I want to talk to you guys also about hyoids, suprahyoids, and infrahyoids. But I'd love to, and forelib down here. And when I'm teaching students this, I'm literally like say suprahyoids and say infrahyoids. The infrahyoids live in almost this exact space and they are below the hyoid bone. And the suprahyoids live in this space, and they are above the hyoid bone. And honestly, that's about all I know about them. I mean, I know more, but my point is that's all I carry around in my massage therapist toolbook, is that there are these tiny intricate muscles here that attach to the hyoid bone and your tongue and things like that. And all these are designed to help you be able to eat and speak and do all these complex things with your mouth, because your tongue has to control a lot, verbally and with your food, and the hyoid muscles help you do that. But they have some interesting connections, which is why I'm going to point them out to you and just make you aware of them. I just want you aware that there are these 4 suprahyoids and 4 infrahyoids. Yeah? And Miss Hunter, good job on your homework, because you identified these as being important to eating and things like that, as well as the masseter and the temporalis and the pterygoids. These kind of fall in that same category. They are important in that sense. Okay, so I'm going to present this. I just want to show you some of these muscles and talk about them for a second. And by the way, since we were just talking about tests and such, just to reassure all of you, the hyoid bones are not on the year-end test. And the hyoid muscle is not on the year-end test. We're not going to ask you to identify all 8 hyoid muscles or something like that. It's just, they're not considered made muscles. But I do like to go over them because they're in the neck area, and it could come up, especially for somebody like Miss Monreal, who is our soon-to-be temporal mandibular joint syndrome specialist. Yeah? Okay. All right. So we can all see the hyoid bone here, right? And it is what they call a floating bone. It's not attached to another bone. It's a little horseshoe-shaped bone in your throat, and it's attached to other muscles, and it moves up and down and protracts and retracts, and it helps you control your tongue and swallowing. And you'll see it's suspended there. There is a very interesting muscle that you can see in this picture called the digastric. Anybody remember what di means? Besides not living? Di means the same thing as bi. Di and bi. 2. Digastric is a 2-bellied muscle. It's actually got a belly in front, a little tendon in the middle, and a belly in back. And if you guys look at the hyoid bone, the digastric is not considered to be one of the suprahyoids in your book, but I consider it a suprahyoid. It's not technically a suprahyoid because it never touches the hyoid bone, and yet it supports it. Do you see how it did that from this picture? Anybody?
Repeat the question, please.
Yeah, Ms. Hunter. So the digastric, which is in this picture, kind of below the jaw here, is this 2-bellied muscle. I call it a suprahyoid because it actually helps hold the hyoid bone up, but it's not in that category normally. So I consider it one of the 4 suprahyoids, but your book will say no, it's not, because it's not, doesn't have the name hyoid in it because it never attaches to the hyoid bone. And it doesn't. However, it still holds up the hyoid bone. Can you see from this picture how it does that? What do you see, Miss Stanley?
If I'm getting it right, looking at the diagram,
Yeah.
how where it's attached
Yeah.
and where it goes through the
Yeah.
thing, the digastric thing is holding it literally just like it reminds me of a zip line, like a.
That is exactly well put. Thank you. I love the zip line analogy. There is a ligament on the digastric. I'm sorry. There's a ligament on the hyoid bone like this, and the digastric's going through the ligament. And you're right. It's like a zip line, and it's meant to be that. It creates a sling for that. So the digastric never touches the hyoid bone, but it touches the ligament that touches the hyoid bone, and that's how it actually helps adjust tension in the hyoid bone and raise it up and down. Yeah. So the digastric in our book, everybody, is going to be a suprahyoid. It's above the hyoid bone. It basically attaches to the hyoid bone. I just want to let you know that technically there's only 7 hyoid muscles. I put this one in with them because what else is it? It's a hyoid muscle as far as I'm concerned. But it does not have the name hyoid in it because it doesn't touch the hyoid bone directly. Whereas all these other hyoid muscles that we're going to study have the word hyoid in them, which is super helpful because years from now somebody's going to come along and be like, blah, 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 myohyoid. And you're going to be like, oh, it's got to be one of the hyoid muscles because they all have the word hyoid in them. All right. So you'll see, by the way, the infrahyoids are in this picture, and they are below the hyoid bone, and they're the thyrohyoid, the amohyoid, the sternohyoid, the sternothyroid. They're all down below here. And they help to pull this bone back down when you're swallowing and things like that. And this is a really good picture too. If you look at it, the bottom of your mouth actually has muscle on it. It's why it's not completely gushy. And it's the mylohyoid muscle, that's the flat muscle that's actually at the bottom of your jaw. Yeah. And we see some other slings here. Do you guys see the stylohyoid muscle? It's actually a sling going through another ligament attached to the hyoid bone. And guess where the stylohyoid attaches in back where you can't see from this picture? It attaches on the styloid process, this little pointy bone back here. Styloid process, this tiny toothpick bone that you'll never touch because it's inside the body, on to temporal bone. So you even have a hyoid muscle that actually attaches to your temporal bone. Let's look at some of these. Okay, so we're just checking stuff out here. You can see the mylohyoid in this picture. Yeah? That's making up the bottom of the jaw. You can see the stylohyoid in the other picture, which is actually attaching to the styloid process here of your temporal bone. You can also see the digastric here, that two-bellied muscle that I consider to be a suprahyoid. The digastric actually goes back to the mastoid process. So, which is crazy, because it's a two-bellied muscle that hooks from your jaw back to your mastoid process. So could tension in this area kind of be related to this mastoid process? Probably. Yeah. So think of all the muscles we now know that attach to the mastoid process. Can somebody tell me just one? Yeah. Well, now I am worried about that.
Like just one random?
Yeah, one random muscle that attaches to the mastoid process.
Sternocleidomastoid. That's the main one I remember.
That's the best one to remember, ma'am. That's the one you should remember. Sternocleidomastoid. Yeah, go ahead.
I have another question. These hyoid muscles and digastric, are they in the chin? I mean, not all of them, but like I know you're talking about throat. But I'm just wondering, like, what's here? Are we talking about that or no?
Yeah. Are they in the throat? Is that what you said? They actually surround
The chin.
Yeah, they are in the chin. You're pushing.
Okay.
You're pushing on the mylohyoid right now, and even the stylohyoid, and even the digastric a little bit up in here too. Yeah, the suprahyoids are literally make up the bottom of your mouth. Yeah.
Okay. When you say the jaw, I was like, I always
Sorry.
think up here, and I just want to make sure I'm getting the right area.
Yes, right here. Suprahyoids, infrahyoids, 4 and 4. Yeah. So anyway, everybody, mastoid process, sternocleidomastoid attaches to the mastoid process. Please tell me another muscle attaches to the mastoid process.
Longissimus?
Longissimus, great answer. You've now given me the front and back fascial line muscles. I love that. Can somebody else give me another muscle attached to the mastoid process? What? can't. Ms. Cooper, I think that's you, and I can't hear you. Ms. Harper, were you going to say something? Maybe? Ms. Harper, were you going to say something?
Is the splenius capitis?
Splenius capitis, thank you. And now we've got the digastric. So just think about this. I gotta mute this. Just think about this area now of the body. It's got all this back tension from the longissimus going to it. It's got all this front tension from the sternocleidomastoid going to it. It's got kind of this side tension from being with the splenius capitis going to it, and it's got this little muscle going to it that actually attaches to your hyoid bone too, going here in front. So this is a very high priority target. You should be massaging the mastoid process on every single living human being. Just walking down the street. Just grab them really quick, rub it, move on. Yes. Okay. That's where the digastric goes. And just don't forget, the digastric lives where the suprahyoids are. For people that are super technical, they don't consider it a hyoid bone. There's only 3 suprahyoids, but I think it's stupid not to include it. You've got 4 suprahyoids here as far as I'm concerned. 1 is the digastric, and you've got 4 down here. And the suprahyoids make up the bottom of your mouth. They make up the bottom of your mouth. They really do. Ms. Hanson, do you have a question? You look very inquisitive, which is good, but okay. There are a bunch of strange little muscles. But anyway, you are rubbing, just by doing this, just by going to the jawline like this, you're rubbing all the suprahyoids, at least parts of them. 4 of them, right here, boom. Cool. But we're not going to learn origins, insertions on them, things like that. So, you've got 3 suprahyoids and a digastric, but the digastric satisfies all the other things that I think should make it a hyoid muscle. So, because it hooks through a sling and holds up your hyoid bone, and it attaches to the mastoid process back here. And so I put digastric in with suprahyoids for my brain to make it simpler, right? In all essence, suprahyoids. So that gives us 4 suprahyoids up here. 2 of those 4, by the way, attach to your temporal bone. The stylohyoid and the digastric attach to your temporal bone. 2 of them. That temporal bone's got a lot of stuff going to it. And Miss Monreal, with your ringing of the ear stuff, this could be another culprit. And it's in deep enough to affect ear stuff too, especially the stylohyoid. They are palpatable. Boom. Let's look at the infrahyoids. There are 4 of those. You do not need to memorize their names. But they all essentially attach to the hyoid bone, and most of them attach it down to your collarbone. And they are meant to depress the hyoid bone, to pull it back down. And they are located just right on the side of your throat here. They're tiny little muscles. I would like to draw your attention. So by the way, the most interesting suprahyoid from our point of view is like the digastric, because it goes to the mastoid process. Stylohyoid is kind of cool too, but it's almost unreachable. The digastric goes to the mastoid process. Super important suprahyoid. The most important infrahyoid is the omohyoid. Why? Where is that guy going? You can see that he is attached to the hyoid bone, right? But where is he going? What is the other thing he is attached to at the other end? Yes, please, Miss Cooper.
Is that the clavicle?
By the way, Miss Cooper, you are 100% right from that picture. That would be the clavicle. But if you look at this next picture, it actually attaches to the superior border of the scapula.
Oh, I can see that now.
Well, you couldn't, I didn't have that picture up before, so it's not your fault. Yeah, it attaches to the superior border of the scapula. So we have a muscle from our throat that attaches to our shoulder. It attaches to our scapula, the superior border of the scapula, which is crazy.
So does it lift the? It doesn't lift the scapula.
I don't think it could. We don't know what the heck it's doing there, by the way, Miss Hunter. Like there's so much debate out there. Like people are like, why would your body attach it to a moving scapula? Like why not
Right.
anchor it down to a rib? Why not, what is the purpose of that? And some people think it might be because you have to move your hyoid when you're in weird positions and somehow it gets angled from that. We don't know. But all of these connections between the temporalis and the scapula and the hyoid bones, we think might have something to do with why people with TMJ and tension here get a lot of relief from working these neck and shoulder areas as well. We're just trying to prove, and we don't know the whole answer to this. This is like giving you half an answer or half a riddle. We just see that there are connections there, and we notice in our work that rubbing these areas seem to help these other areas, so we know that it's all kind of interrelated, but we don't understand the complexities of the suprahyoids and the infrahyoids at all. We have no idea why this omohyoid is going down to the scapula.
That's strange. I never thought there would be like an anatomy thing that no one understands.
Well, there's actually a lot of anatomy mysteries that no one understands. And I used to have a student who was a PhD. Yeah, she had a PhD in some kind of sports medicine thing. It's a long story why she was even taking the class. But basically she wanted a license so she could touch people in certain regards that she couldn't right now. Your massage license was really helpful for that. But she was a big believer in these hyoid muscles and how they relate to stress and stuff like that. And when she was working certain areas in your body, she would ask you to swallow on purpose, like hard swallow, like, because she said that act while she was working on your shoulders helped to reset your hyoid muscles and helped to reset this whole area. And she did all sorts of studies, really interesting studies about literally effects of swallowing and how it helps to reset certain things and such. It was really interesting.
Interesting. But I thought in our studies that like if a muscle attaches somewhere, like an origin and insertion, that it does something, or if it's up front it pulls, and if it's in back, I don't freaking know. All I know is.
Well, we know. By the way,
know.
we know this thing goes. We know this thing goes from here back to here down, and so we know that it could retract and depress the hyoid bone. We know that.
Okay.
And we
All
know
right, so it's not okay.
It's not a mystery what it does in that sense. We know the action, but why? Why did God or whoever, why did they attach to the scapula this thing that it's moving too? Why not pick a fixed spot? We don't understand what the significance of it is. And I will say the neat thing about that I've experienced about the human body is there isn't wasted stuff. You know, a lot of times people are like, oh yeah, your appendix, you don't need it. No, we're very well designed. And so there's got to be a really good reason why it goes to your scapula, and nobody knows the really good reason.
Is it palpable? Why can't I say that
Palpatable?
word? Yeah, but like from the scapula or only in the chin area?
I have never found this muscle.
Okay.
I think they made it up. No, its problem is it's so darn deep. Like to zero in on it, and you can't tell when you. I mean, I don't know. You and I could actually play. I'd be happy to sit down with you, and we could try to find it. You know what I mean? We'd actually have to have you swallow and move your hyoid bone around while we're looking for it because we want to find the thing that's moving with that. But it might be able to be done. But I just think it's really deep. I don't know how we're going to get it on the scapula.
Oh no, that's fine. I just
It's neat though.
like honestly, once I know that a muscle is not palpatable, then I'm like, well, oh well, like that's it. Like I completely forget about that muscle. Like,
Yeah. And it's part of the reason we don't have you learn origins, insertions, and all these because we're like, really, if you know that the suprahyoids are here, you can literally rub the bottom of the jaw, which is the only palpatable area for all the suprahyoids, because you can't get inside into the styloid process and stuff here. So if you rub the bottom of the jaw in the mastoid process, you've hit all the places you can hit with the suprahyoids, right?
Mhm.
And you don't need to know which one you're on. You hit all of them. Boom. And down here, really, you literally rub the side of the throat and you've hit all the palpatable areas pretty much of the infrahyoids. And then that omohyoid disappears under here. I guess we might be able to find it. I don't know. Anyway, I've never found it.
All right, thanks.
Yeah, thank you. Really good questions. Miss Monreal, you have been so patient today.
I know.
What's on your mind?
So now that we're looking at these muscles, what is the reason that you would move the trachea over that you were talking about? Remember?
Yes, you're right, because you don't need to move the trachea over to get to these muscles. They are on the trachea, right?
Right. But what, I guess, so why would you even want to do that? What would it affect?
Well, because, I think it's on this slide, because you would get to this. If you move the trachea side, this is, do you see the slide right now? This is the anterior picture of your cervical vertebrae. And that's
Okay.
the longest capitis. It's actually a muscle in the front of your the front of your spine, front of your cervical spine. But that's behind my esophagus and windpipe, right?
Uh-huh.
So it's back in here, and the way to get to it, it's like kind of on the transverse processes, but within, you kind of come in from the side here and go in. And so you pop this guy over just a little bit, and it actually pops a little bit. You'll hear it go pop. And then you go in. And that's why you might do that, is to get to the longest capitis. Yeah, go ahead.
Can you show us that in clinic after you mess with
yeah.
my ears?
Yeah, Miss Monreal, there's not a day that's gone by that I haven't wanted to move your trachea side, so
Okay, whatever.
I'd be happy to demonstrate that on you. Yeah. And the longus coli. So longus coli and longus capitis are both front anterior neck muscles. And that's all we want you to know about them. So honestly, this could be in your homework even, or on a test or something. But if I ask you where the longus coli is, or the longus capitis, I just want you to tell me behind the throat. Look, they're on the anterior side of your cervical vertebrae behind your throat. I mean, we just want you to know they're back in here. They exist back in here. Does that make sense? And they're meant to tie the front of your neck together. And they can be affected, by the way, especially in things like whiplash. These guys get it too. If the person goes way far back, these are a lot of the muscles that'll tear too in the front side. And they are accessible. You can move a throat over. You want to have darn good reason for doing it because people do not like you messing with their throat. Unless you're Miss Monreal. Yeah? So, yes, Miss Monreal.
So what, I know you just said whiplash, but I've often wondered, even as far as the multifidi and the rotatories, I always hate saying that. What would cause a muscle so deep to be restricted anyway? Because I tend to think like, okay, so I can understand why some of the superficial muscles, like, they're tight and whatever, but something that's attached to the spine, like, I can understand the neck one where there was a whiplash. Why would the other ones be restricted?
Like the multifidi and the rotatories?
Yes.
I think this is true of the longus coli and the longus capitis too, by the way. It doesn't have to be whiplash. The fact is, I think oftentimes small muscles are more maxed out than your large muscles. Right? They're trying to take over.
Because they're support. Oh, go ahead.
Yeah, they're playing supportive roles and they're trying to stabilize stuff. And if you've maxed out the big muscles, they kind of have to jump in and take over even more, and they get exhausted and locked down. And they also are very close to the nerves that come out in that area, so they're very prone to pinch over their own nerves.
Okay, thank you. Your answer makes sense.
Good. Woo, we're doing good today. Yeah. And that's it, everybody. Longus capitis, longus coli. Yeah. Where are those located, Ms. Yanez?
That's your spine, right?
Yes. So longus capitis and longus coli, I just want you to know they're behind your throat or on your anterior cervical vertebrae. Does that make sense? I just want you to know it's back here. So if I ask you guys about longus capitis or longus coli, it's just these muscles that are found on the anterior cervical vertebrae, but posterior to my trachea and esophagus. Right? Cool. So, today we just covered a lot of stuff. We were trying to make up for a little bit of lost time, but also some of the stuff we're not learning origins and insertions on. Right? So let's talk about some of the highlights from today. Okay? From what we've done so far. Let me stop presenting this. Okay, highlights from today. Mr. Kandaris, sir. Mr. Kandaris, you there? Mr. Kandaris. Are you there, sir? No? Okay. We'll come back to you. Miss Harper.
Yes, sir.
How many suprahyoids do I have?
Superhyoid. Hyoids.
Mm-hmm.
Okay. 2.
What?
2.
4. So take your
4.
hand like this. Everybody take your hand like this. This is why I do it. I got 4 fingers,
Oh, okay.
4 suprahyoids. 4
Four
fingers,
okay.
4 infrahyoids.
Got it.
Cool. And by the way, one of those is not technically a suprahyoid. It's the digastric, but we're going to call it a suprahyoid because it's up here and it's doing the same stuff. Yeah.
I didn't hear
What?
the internet is kicking me out.
Oh, okay. Don't worry. No worries. No worries. You're good. Miss Balatic.
Yes.
Madam, how many suprahyoids do I have?
4.
Yes. And where are they found?
Below your chin.
Beautiful. Beautiful answer. Thank you. That's what I want. Just straightforward stuff. Miss Moore.
Yes.
How many suprahyoids do I have?
4.
Yeah, where are they found?
The super, up, infra, down.
That's true. Good point. How many infrahyoids do I have, ma'am?
4.
Thank you. It's been a pleasure. Miss Felix Osuna?
Yes.
How many suprahyoids do I have?
4.
Good. Where are they located roughly?
Below the chin.
Below the chin. Great. They make up the bottom of my mouth, basically. Yep. And how many infrahyoids do I have?
Was it 4 for that one too as well?
Yes, it is 4 for that one as well, too. And where are those found?
Right below the chin.
What?
That would be like on the neck area.
Yeah, she's right. It's kind of just on the throat right here, right? Right below the hyoid thing. And they take up about this much space, too. That's why I like doing this. Cool. Thank you.
Yep.
Miss Torres.
Yes.
Miss Torres, where would I find the longus capitis and longus coli?
And back of your throat?
Yeah! So they're on the anterior cervical vertebrae, but the back of my throat. Well done. Thank you. Thank you, thank you, thank you. Miss Cooper.
Hey.
Hey, Miss Cooper. Miss Cooper, where would I find the longus coli and the longus capitis?
The longest cola is the one in the interior, like, throat.
Mm-hmm.
And then what was the other one?
Longus, did you say longus capitis? It's the same answer.
They're also in the anterior throat.
Yeah. Yep. Anterior cervical vertebrae behind the throat. Yes. Cool. Okay. Thank you, ma'am. Miss Hunter.
Yes.
So you basically answered this in your homework. This is why I'm asking you. Can you tell me the muscles that would be involved with eating and talking and all this kind of stuff that we should consider if somebody's maybe having problems with eating, talking, temporal mandibular joint problems, anything. And I can think of a lot of muscles that would fall into this category, but can you tell me some of those muscles?
Well, the hyoids. That's what we've been talking about. So I guess the suprahyoids
Sure.
and the digastric.
Sure. So the digastric
the
is part of
temporalis.
Yes, temporalis. Good.
And the masseter, of course.
Good. First culprits, temporalis and masseter.
Right?
Yep.
Yeah.
Yep. And then you have medial and lateral.
I don't know how to say that.
Pterygoid.
I know what you're talking about. Oh yeah, I know it's a
pterygoid.
goid, but I was like, I don't know. I'm just gonna say goids.
Yeah.
Medial
Okay.
lateral petrigoid.
Yeah. Pterygoids.
How do you say it?
Pterygoids. This P is
Oh,
silent.
Terry. You
Yeah.
don't say the P. Oh, okay.
I know it looks like pterygoid, but it's not.
Yeah.
So, okay, good. That's what I'm talking about. So if you got somebody with jaw problems, you guys might want to definitely work the temporalis, definitely work the masseter, work the lateral pterygoid, maybe the medial one if you want to get inside the mouth. It wouldn't be stupid to work this area where the suprahyoids are. It wouldn't be stupid to work this area where the infrahyoids are, right? And it wouldn't be stupid to work head, neck, and shoulders, especially around the mastoid process, because we now know of a lot of muscles that attach to the mastoid process. We now know of the digastric that goes back here along with the sternocleidomastoid, mastoid, along with the splenius capitis, and along with the longissimus, all attaching back here. Cool? Big stuff. Questions, everybody? Comments? Thoughts? Anything? Just want your homework? Just want me to be quiet?